Welcome to The Explainer. Today, we're tackling something that often gets ignored until it starts screaming for attention: our feet. As a pharmacist, you're right there on the front lines. Patients come to you first with these issues. So, we're going to give you a solid, structured way to assess common foot symptoms, a clear process you can use every single time. Okay, let's get into it. First things first, just to get a sense of the complexity we're dealing with, look at this number 26. That's how many bones are in each one of your feet. It's an incredible piece of engineering.
And it doesn't stop with the bones. On top of that, you've got over 100 tendons, muscles, and ligaments all working in concert. And this is exactly why a random, unstructured approach to foot problems just doesn't cut it. You really need a system.
And this is so important. Because ignoring foot problems isn't just about a little discomfort. As this research points out, it can lead to a delayed diagnosis for something serious, and it can genuinely impact a person's quality of life. We're talking about their mobility, their independence, everything.
So how do we tackle this the right way? Well, that's the heart of what we're talking about today. We're giving you a clear assessment framework you can use right there in your pharmacy. It's designed to make your patient conversations way more effective and, honestly, a lot more efficient.
Every great assessment starts with one crucial question. It's the one that immediately points you in the right direction. For foot symptoms, this question splits your entire process into two very different paths. Any guesses what it is? And there it is. Does the patient have diabetes? This is your absolute first step. A yes here changes the entire game. It means you're heading down a much more specialized path because the risks are so much higher. A no means you can stick to a more general assessment. It's a critical fork in the road. Now, no matter which path you go down, these 4 steps are your foundation. They're universal. First, you're going to get a really thorough patient history. Then you'll do a clinical examination, actually look at the feet. From there, you establish a risk level, and finally, you figure out how soon they need to check back in. It's simple, it's structured, and you can repeat it every time. Okay, so we've got our framework. That's the how. Now let's jump into the what. We're talking about the common conditions you're going to see day in and day out, and more importantly, how you can start to tell them apart. Think of this as your quick reference guide. For a plantar wart, the dead giveaway is pinpoint bleeding if you gently pare the surface. You won't see that with a corn or callus. A corn will have that hard, painful central core. For athlete's foot, you're looking for that damp, scaly skin, especially between the toes. And with a fungal nail, the clues are all in the nail itself. It gets thick, discolored, and brittle. These little details are your best friends for a quick diagnosis. All right, let's go back to that crucial first question and really focus on that high-risk group, our patients with diabetes. For them, the risk of serious problems like ulcers that won't heal or major infections is just so much higher. That's why a specialized approach isn't just nice to have. It's non-negotiable. And the best part is, you don't have to invent a process from scratch. There's a fantastic, validated tool that's perfect for the pharmacy setting. It's called Inlow's 60-second diabetic foot screen. And yep, the name says it all. It's fast, it's evidence-based, and you can easily build it into your workflow. So what are you actually doing in this 60-second screen? It's basically 4 quick checks. You'll test their sensation with a monofilament to check for any nerve damage. You'll do a good visual inspection of the skin and nails for any cuts or issues. You'll check their foot pulses to make sure blood flow is good. And finally, you'll look for any deformities, like bunions, that could cause pressure spots. So, once you've done the assessment and you know their risk level, what's next? Well, for patients with diabetes who fall into that lowest risk category, the guidance is crystal clear. The number you need to remember is 1. They need a comprehensive foot assessment at least once a year. That's the bare minimum, your baseline. Okay, we've covered the how, the what, and the who. Now we get to the most important part, the now what. How do we take all this great information we've gathered and turn it into a real, concrete action plan for a patient? This is your final game plan. Step 1, you lock in their risk level: low, moderate, or high. Step 2, based on that risk, you set up a clear follow-up schedule. Step 3 is all about patient education, teaching them how to take care of their own feet. And step 4, on this one is absolutely key, is knowing when something is out of your hands and it's time to refer them to a specialist.
So, we'll leave you with this. You now have a system for assessment, a guide for telling different conditions apart, and a specific tool for your highest risk patients. The only real question left is, how is this going to change the very next conversation you have with a patient about their feet? Thanks for watching The Explainer.